This is a Central Line train to West London.
Ladies and gentlemen,
Exponential technology is changing the way we live, work, and play. But the human mind does not deal with exponential thinking very well. We are seemingly on the first step of a staircase that promises to carry us into an unknown future that many of us are simply not prepared for. So to understand the current state of the world's most powerful exponential technology, I have traveled to London Tech Week to meet up with some of the world's leading technologists and thought leaders to help you understand the implications of these technologies on your world. My name is Matt Brown, and this is the State of X.
This is the biggest and most ambitious festival of technology this country has ever seen.
I recently came across an article in the UK media which described how a man was accidentally circumcised after a hospital mistakenly carried out the wrong procedure. The patient was supposed to have a cystoscopy, a procedure which examines inside the bladder using a thin camera. Unfortunately, the surgeons instead removed his foreskin after mixing up his medical notes with another patient who was meant to have a circumcision in September of 2018. So digital technology can go a long way in preventing these kind of mix-ups from happening, but more importantly, it promises to fundamentally change the end-to-end experience of patient care. But what is the current state of digital healthcare? To get the answer, I reached out to Dr Sam Shah, a clinician and director for digital development for the NHS in England. His main focus is using digital technology to optimize access to health services and contribute to health system efficiency whilst ensuring the best outcomes for patients. Hey guys, welcome to another cracking episode of State of X. I'm here with Sam Shah. He is the
Director of Digital Development for NHS X.
a very important man in the health space. That's all you need to know. But what exactly is your role at the NHS? England only, of course.
In England. So I'm really lucky. I get to work with patients, clinicians and the system to put together technology that will help patients access services, to help different services connect together, for example, booking patients between services, and other things like making sure the ambulance service, our national 111 phone service, our 999 number, all has technology behind it that works and gets patients when they need urgent care into an emergency setting easily.
So what are some of the innovations that you're currently looking at implementing within a massive health network like the NHS in the UK?
So I think innovation is a really difficult thing for us, because we have lots of great ideas in every part of the system. I mean, imagine, we've got 1.8 million staff overall across the whole system, and we have more than 22,000 organisations. So we have a lot of ideas flowing. So everyone wants to do something innovative, and that's a good thing. But one of the challenges we do have in innovation is changing that innovation from being an idea to getting some adoption and then some scale. And the way we're tackling that is really working out what are the big problems we can solve, because we're not always the best at setting out the problem. Some of those things that we could do, and we're trying to focus on right now, is how do we do things like get the booking issue solved. So that's one of, I wouldn't say it's an innovation, but it's a technology program that we're trying to get into the system to help change the lives of patients. Other things that we're doing that might be innovative but aren't really innovations, other people here have already done them, is getting things into our telephony service to make it easier to identify patients. So if you were to phone up one of our services right now, you might have to repeat yourself and explain who you are and say it again. What if we can make that easier, that it's dealt with at the point at which you're phoning, the other person already knows who you are, and might even know a bit about you by that time. So those are things that we're trying to implement across an enterprise level.
Know your patient.
Right.
Quite an important thing. I was reading on the BBC front page of the BBC News website the other day. There was a patient that was in the NHS and he was in for like some random procedure, but he actually got circumcised because there was a mix-up with his data and his patient records. Obviously not an ideal situation. And more broadly, I think though, you know, as technology kind of advances and these innovations that you talk about start to really manifest and get implemented within the NHS framework and system, what do you say would be kind of the key outcomes as it relates to patient care?
Right. I mean, for us, first and foremost, is safety and the quality of the clinical outcome. That's the first thing. Then if we think about technology in the health service, it's safety, security, and privacy. Those are the most important things. Once we deal with those things, everything else follows. Efficiency is the next thing that comes after that. But these are the important things for us as a system. But safety is very important to us, and that's why we need to make sure that data, for example, is set up in a way that means that the data that we have is visible to the right clinician when they need it. So if I see a patient in my practice or anyone else sees them, and I ask them about the allergy, that same response that I've got is visible to anyone else in the system, so that we can avoid any sort of risk where possible. Other things, for example, though, what if a patient wants to be seen virtually? It should be possible for them to connect to a doctor who can see the same information that the previous doctor had. And even other basic things. If I transfer someone from an ambulance to the hospital department, it's important that the data about what's wrong with them moves with that patient. So all these things are important, but safety comes first.
Okay, so it's about the patient experience end to end,
Right.
from onboarding to diagnosis to getting that diagnosis looked at, and essentially the end-to-end delivery of patient care.
Completely. It's everything from the point at which somebody might even think they're unwell, some awareness about the condition, access to information, help them to support themselves. Then what's the next point of signposting into the system? Get them access to a clinician in the quickest way possible for whatever it is they happen to need. Get them access to diagnostics. Once that's happened, then into treatment if it's necessary, or support and advice, then any follow-up. What we're moving towards now is more of a social prescribing-based model, where are there other ways we can support our patients in the system? Are there other systems out there that they have access to, support networks, help, communities? And online, digitization gives us an opportunity to do that. It connects people together in a way that could never connect before.
Health tech, really, really important. Access to health, access to financial services, access to agriculture. All these access to platforms are becoming more and more prolific, more and more kind of advanced, more and more enabled, more easily adopted, etc. What's your view on health tech today? Like when you're looking at, with your NHS hat on, which is a huge, huge mandate, and then you've got a startup community that's truly innovating. How are you engaging with them?
So for me, it's about thinking about that multi-vendor and ecosystem approach. Now traditionally, that was not the way we often work. We have the legacy of a system that's more than 70 years old. So to do that, we have to operate differently. And that means we have to think more about platforms, standards, and interoperability. If we focus on those three things, we can develop and grow that ecosystem. We can help those small SMEs get in and know exactly what they're building towards, and make it easier for them to connect to us. Right now, they might have to connect to us 200 times. They might have to connect to us 400 times in different parts of the system. But what if we can open that up and make it so simple that whether they connect to one hospital or 20 hospitals, it's the same process. And that's one of the things we're aiming towards. So hopefully if we move some of our data infrastructure to a platform-based approach, open that up and allow third parties to connect where it's safe to do so, they will help us to get care to patients, and we can democratize healthcare in a much easier way.
I'm a health tech startup. I'm based in Africa. I believe I've got a health tech play that's really relevant in all health networks around the world. But I'm really interested in the Department of Industry or International Trade and the work that they're doing with bringing great technology to the UK for potential expansion, implementation, adoption, etc. How do I engage with you? Where do I start? What's step number one?
We are so lucky that we have the Department of International Trade, and we have a number of other government departments working together to encourage those companies from around the world to come and work with us in the UK. And there's a really easy way of doing that. They first of all have a discussion with the DIT, who will then explain what they need to do to establish in the UK. We also have a network that's available to them that gives them access to the information on what they need to establish in the UK as a health tech provider, what governance and regulations they have to fulfill, how many people do they need, all of those things. And then there's the next part, using our academic health and science network of connecting to local parts of the system, and our national teams for those infrastructure projects that are national. And after going through that mechanism, they'll connect with the local part of the system in the NHS, and provided they meet all the requirements, they're in the framework, they've developed those local relationships, and they are solving a problem that needs solving, then there's some hope that they can then progress. And there are good examples. For example, I met with a company from Israel recently that's done that. They started off in Israel, they've scaled in the UK. I recently met with a company from the Middle East that started developing ophthalmology software in the Middle East, is now live in some clinics in London. This is happening. So there are companies that are making it into the UK who have started off as small SMEs elsewhere and are growing over here.
You mentioned the word regulation just now. Do you feel that the regulators, the health regulators, and just more broadly policymakers within the UK are keeping up with the pace of technology and innovation?
I think this is a challenge for any regulator around the world. When I speak to my colleagues in any government around the world, they face the same problem, the balance between regulation on the one side, innovation and scale on the other side. I think we have the same challenges at a different scale, and we're lucky that our regulators are all coming together, we're working together to try and work out new ways of supporting innovation, health tech development in the UK. Now, it's never going to be perfect, but it's certainly a lot better than it was 10 years ago. And I certainly feel with the creation of NHS X, our new national body that's going to come together to bring innovation and technology into the NHS, we have to get much more consistency between our regulators. So it's not perfect, but it's getting a lot better. And I'm really pleased that our regulators are working together to create open standards, transparent rules on how technology providers can work in the NHS.
Okay. Why do you do what you do? What gets you out of bed in the morning?
I'm a clinician. I still see patients, and what's really important to me is patients get the best treatment they need in the most efficient way. And if we can do something that puts that healthcare back in the hands of the patient, and means that I can be the most efficient when I see those patients and making sure I meet their needs, that's important. In a publicly funded system that we all face around the world, there will never be enough resource to meet all the needs of the patients out there. If we can do something that puts some of the control back into the patient's hands, empowers them to get the best out of healthcare, and allows us to make a difference, that's a good thing.
Sam Shah, thanks for being on the show.
Thank you very much.
And a lot of people see Africa as too difficult because there are so many innovators, and in fact a lot of UK businesses are scared of going to Africa.
Why though?
Because they can't move as fast, right? It's actually a benefit to actually think that fast. We're so used to going, well, our development cycle is this long and we've got a set market and we've got incumbents and this is how the way things are done.